Very good. Thank you very much. Thank you and good afternoon to you. I want to go through the okay. Why did we choose medicine and why did we study medicine? And I think the idea that you are involved in making people feel better, both physically and mentally, is an honorable one. And I don't think there is any job in the world that is equivalent to that. So to start with, it's a very important job that you are in a position to help fellow humans to feel better. The other reason I chose medicine is because medicine is a fascinating science. I've been doing it for over 50 years, and I still love to live for another 50 years to do it more. Now, 56 years ago, I was a third-year medical student when they introduced normal histology and then pathology. On the third lecture in the third year of medical school, I fell in love with it. And I decided then that I'll do pathology. And these are pictures of pathological lesions in the same organs that I showed you earlier. Now, to produce slides, you go through taking the biopsies in paraffin blocks and then section them into thin sections and then making slides out of these. So the slides are there for you to look at down the microscope. And I was involved in all my life in teaching and training junior doctors to become pathologists as well, which is a very honorable thing to do as well. I enjoyed it thoroughly. The importance of pathology is that you are part of a team which is called multidisciplinary team, which will discuss every single cancer that comes in the department, and every patient is discussed amongst radiologists, pathologists, oncologists, surgeons, and so on and so forth. And 56 years later, I'm still in love with this business. Now, the tissue blocks and the slides are the property of the patient. It's just like the patient's notes. These are also their properties. So if there's a deliberate tampering with the existence of these slides and blocks, you must speak out, wouldn't you? It is very important that you make sure that the process is followed and the protection for patients is constantly there. I work with my colleague here, Professor John Schofield, who is sitting in the second row, in a department when transparency and openness is followed and every single cancer is reviewed by another pathologist to make sure that the diagnosis is correct before treatment. And then you notice low staffing. Say, for example, you were in a department with 6 consultants, but the workload is for 10 consultants. And you start working for 10 hours, 12 hours a day, and then go weekends. And you feel errors may occur. And in one of my letters, I actually said exactly this: who will be responsible if an error occurs? And that is following repeated raising concerns about staffing levels. Now, we report in a system which is basically called the LIMS system, where pathology reports go on the computers and so on. If you discover a fault in the software, you report it, and you don't stay silent because errors will occur. And this is another thing that people may get in trouble with, because companies are chosen by the hospital, and you feel you are responsible to make sure that the system is perfect and accurate. If you discover somebody stealing money from the NHS, and this is the figure, the estimated figure, 1.198 billion pounds are lost from taxpayers' fund every year because of fraudulent behavior. You won't stay silent about this, would you? The other thing is, people invite companies who want to make money and say, we are the experts in telling you what is right for your hospital. And I said one day in the MAC meetings, the Medical Advisory Committee meetings, who is better to tell what we need in this hospital than the people who are in the hospital? Why waste another 20 or 30 or 40,000 pounds on a company to tell you what to do? So you request simple things to make sure that errors will not occur. And what we heard all the years, there is no money. Do not ask us for anything that costs more than £100. Now, what do you get for £100? Perhaps 2 boxes of chocolates of good quality. Then suddenly there are millions of pounds appearing from nowhere. And I took this picture with me to see my MP, and I say, you in government say always about we are putting that number of billions of pounds in the barrel to ensure that the NHS runs. Who is plugging the holes? Nobody is talking about the holes. And how many of these holes are there, and how big are they? Albert Einstein, the famous physicist, not only famous in his physics and discoveries and theories, but he said this: the world is a dangerous place, not only because of those who do evil, but because of those who look on and do nothing. The German Medical Council encourages us, as good medical practice, to say if there is something wrong. In football, fouls are not acceptable. And in football, a whistleblower is fully protected. In the NHS, the whistleblower is not protected. This is a report by the GMC telling the number of cases of harassment and bullying over a year in many hospitals in the country. This is a nationwide. 19%, 20% of doctors say we are bullied and harassed by managers and so on. And I said in one of the other meetings that we had, why should there be bullying in a place created to make people feel better, both physically and mentally? It's not allowed. The figure should be 0. Now, one of the problems we face is that when doctors are chosen by managers to work with them to run the hospital, many of them do an excellent job, and we will hear from our colleague here, Charles Ashton, the good example, and there are good examples. But some, unfortunately, benefit from being the shoe polisher for managers, to be there to be protected, to be there for their personal reasons, to be there to forget about their duties as doctors. And many of the problems arise or start from those people. So having raised genuine concerns all related to service delivery and patient care, you become a target. And instead of investigating your concerns, they investigate you. You receive a call or an email inviting you for a meeting. They say, I'll come with my union representative because you smell something unusual. Oh, no, you don't need that. We are only having a usual, ordinary management meeting. Come along. Don't bring anybody. Shall I bring documents to prove that I have raised concerns? No, nothing. No documents whatsoever. Just come on your own. And you walk into an ambush, totally unexpected, shocked that you see people who you see in suits and ties wearing the military uniform that moment. And you face that and you are shocked. They say, concerns were raised against you. You are not allowed to practice until we finish our internal investigation. Go home, visit your GP, and take a sick leave. And remember, do not speak to anyone about this. So that's the red line. So at that meeting, you feel empty, shocked, humiliated, stunned, broken. And the next thing is, what do I do? Am I reaching my end of service here in the NHS? I will run away. It's an easier way. I will retire, maybe resign, move jobs to another hospital. And some, unfortunately, committed suicide. So the next day, when there are more than one case like that, The hospital will have this fear culture sweeping the environment of the hospital. Others remain silent, don't speak, because look what happened to them, and that, and so on and so forth. And morale will be low. And of course, when there is a fear culture, the performance goes down hand in hand, and the cost of the service goes up. A few decide to stand up. They say, I'm not taking any of this, because this is absolute nonsense. I am doing a good job. I am a good doctor. My patients are in my heart, and my services are excellent. My appraisals say so. What they do, they tighten the screw on you. Further humiliation. A second NHPS investigation. GMC referral. Some other substantial reason for dismissal. So who saves your life? It's your family. They give you the unconditional love that and they have no idea what's happening to you. They just make you so comfortable. You go there, you're tired, exhausted, sleepless nights, and you just have a cuddle with them and go to sleep. And that's what I did for many months. I went to sleep as I hugged them. So you file an ET1 because this is unacceptable. They won't hesitate to waste, abuse millions of pounds to destroy you in court. And these are the figures given by a colleague of mine who works for the GMC. And look at the number of doctors referred to the GMC per year, 10,000 doctors or more in 1 year. Now the question is, how many managers have been referred to the regulator? Is there a regulator for the managers? So it has always been a one-direction issue. So do you know of any case you can tell me when doctors investigated managers? I don't think that exists. So this is very irregular, and it indicates a system failure. And you sit there and say, I'm looking for justice. So I said to myself, I'm looking for justice. Okay, how many cases are there out there like me? And this is the idea when Justice for Doctors came in my mind. So that was established in 2019, and we are a group of victims, say doctors, who provide support and guidance for individuals experiencing discrimination and bullying, for raising concerns about patient safety, and it is free of charge. We don't charge anything. Advocate for cultural and system reforms to protect patients, the NHS, and public funds, and lobby for individual cases, and promote awareness across sectors and government levels. What we discovered in our meetings is the disquieting pattern. There's a pattern there. You raise concerns, they are not investigated. They raise a bogus case against you. They appoint a retired HR person to humiliate you. You produce documents to prove them wrong, they change the terms of reference for another MHPS investigation. Now it's your behavior, not capability. You produce further documents to prove these wrong, they refer you to the GMC. You take them to ET, they appoint several lawyers and do not hesitate to waste millions of pounds to destroy you. And what we have seen in the Lucy Letby case is just a minor example of what has been happening all over these years. It's the same thing. It has been going on for long. So justice for doctors means justice for patients, because we have the patients in our hearts. While engaging with Justice for Doctors business, something remarkable happened. Is meeting wonderful people, remarkable people, forces for good. And they are sitting here with me. Professor Jane Somerville, Wimblanc, Dr. David Ward, they are not members of Justice for Doctors. They saw the reason why we have created this group, and they came to our help. They are there guiding us, supporting us, and advising us what to do. And we respect their input in all this. So to finish, I will hand over to our remarkable person, the force for good, Professor Jane Somerville, and exactly on the... Okay, so let me
No, I haven't got slides. I don't want.
No, you haven't.
No, I'm just saying hello. Good morning. Well, I've been introduced, and my co-eval is David Ward. We're retired, rejected, absolutely enjoying all this together as cardiologists. And we came here for a conference. And we met some of the people you'll meet today, and we were so horrified at what was going on in the health service that we liked, loved, respected, that we resolved to use what skills were left for us, and that mightn't be too much, you could say, and that we'd do something about it. So we find ourselves here today. It's taken some time. We've been absolutely welcomed by Justice for Doctors, and we are part of your effort.